Today we'll continue with the complement system class. Okay, system complement system. Yesterday we have seen that this complement system comprises of three pathways. One is classical pathway, another one is lectin pathway, and one more is alternative pathway. Okay, all these three pathways will converge at C3. Okay, C3. In this alternate pathway, I'll tell you one more important point. What happens? We have seen formation of C3b and bb. Okay, formation of C3b and bb. Okay, this complex has C3 convertase activity, so that it will convert C3 into C3a and C3b, and it also has a little bit of C5 convertase activity. Okay, C5 convertase activity. If little C5 convertase activity. Okay, whenever this C3bb is attached with one more 3b, then this C5 convertase activity will be increased. That means if one more 3b is attached, then C5 convertase activity will be increased further. That means C3bb, n number of 3b's attachment to C3bb will increase C5 convertase activity. This is very important point. You can get a question on this. Which one has more amount of C5 convertase activity, C3bb or C3bb, C3b? Out of these two, which one has C5 convertase activity? This one. Okay, C3b, bb, one more 3b. If it is given like 3b to the power of n times of 3b, it has more C5 convertase activity. Okay, that is the difference. Okay, this is very important. Okay, next we'll see the regulation of complement activation. What happens here in this regulation? How will you regulate this complement system activation? One is at the level of C1. Okay, this C1, what is the function of C1? It will bind with immune complexes. This binding of C1 with immune complexes is inhibited by C1 inhibitor. It can be called as C1INH. Okay, C1INH. What happens here is this inhibitor will prevent binding of C1 to the immune complexes and no further complement activation. Okay, next, this C1 inhibitor is a protease. So it will inhibit both classical and lectin pathway. Both pathways are inhibited by C1INH protease inhibitor. Okay, this will prevent attachment of C1 to immune complexes and no further complement activation will occur. Okay, next regulation step is decay accelerating factor. What do you mean by this decay accelerating factor? It is also called as DAF. This means accelerating. What they'll accelerate? They accelerate breakdown of C4b and C2A complex. Then what will happen? These two will be separated. C4b will be separated and C2 will be separated. This C2 will diffuse away. They will not be near to C4b, and C4b will be degraded. If this happens, there is no formation of C4b and C2A complex. If this is not formed, it cannot convert C3 into C3A and C3B. Okay, this happens. Okay. Next what will happen in alternate pathway? This is about we can see in a classical pathway and lectin pathway. Okay, in alternate pathway, this decay accelerating factor is also having an effect. How they will have an effect? This decay accelerating factor in alternate pathway, they will separate 3b from convertase. They'll separate 3b from convertase. If it is separated, 3b from convertase, then there is no conversion of C3 and C5. That means there is no further proceeding of complement system. Okay, this is what happens. This is how complement system is regulated. Next, we'll discuss clinical point of view, clinical aspects. Okay, clinical aspects. In this, we'll see complement deficiencies. Okay, whenever there is an homologous deficiency of any complement, C1, C4 and C2, what will happen? What is the function of C1? They will bind with the immune complexes and dissolve the immune complexes. If C1 is deficient, what will happen? If these complement systems are deficient, then what will happen? They will increase immune complexes, and these immune complexes will be deposited in tissues. If these are deposited in tissues, what will happen? They can cause different types of diseases like systemic lupus erythematosus and glomerulonephritis. In kidneys are damaged, glomerulonephritis, because in nephron the subepithelial deposits will be there, subendothelial deposits will be there, crescent formations will be there, and vasculitis, blood vessels will be damaged, small blood vessels will be damaged, and you can see petechiae or purpura, everything in the vasculitis. Okay, normally the function of C1, C4 and C2 is to bind with the immune complexes and to dissolve those immune complexes. Okay, but what happens? These immune complexes are formed by antigen and antibodies reaction. If these are deficient, then immune complexes will stay in the body like that, and these immune complexes are deposited in the tissues, and these deposition of immune complexes in the tissues will cause different diseases like systemic lupus erythematosus, it is called as SLE, and glomerulonephritis and vasculitis. Okay, they can suffer from pyogenic infections by the bacteria such as streptococci and staphylococci. Okay. Next, in lectin pathway, if there is deficiency of MBL, what is mannose binding lectin or mannose binding protein, they will result in serious pyogenic infections. In which age group? Babies and children. What will happen? They will suffer frequently with respiratory tract infections. Okay, respiratory tract infections. And whenever there is a deficiency of factor D and properidin, what is the function of properidin? They will stabilize C3b and bb. Okay, they will stabilize C3b and bb. Whenever there is a deficiency of factor D and properidin, they are affected by Neisseria gonorrhea infections. Neisseria gonorrhea infections. Okay, whenever there is a deficiency of factor D and properidin, they will have Neisseria gonorrhea infections. Okay, next, if C3 is deficient, they will have recurrent bacterial infections. Okay, and immune complex diseases. Okay, whenever there is a C3 deficiency. Whenever C4 deficiency is there, they will suffer with Streptococcus pneumonia, Haemophilus influenza, and Neisseria meningitidis. Okay, these are the infections which are seen with a C4 deficiency. If formation of MAC, that is membrane attack complex, is deficient, complex formation is defective. Okay, membrane attack complex formation is deficient, then they will have Neisseria meningitidis. Okay, next, one more important deficiency is deficiency of C1INH. What is this? C1 inhibitor. Whenever this C1 inhibitor is deficient, they will cause overactivation of complement system, and over production of C4 and C2, and they will cause increased production of vasoactive mediators. If these vasoactive mediators are increased, then they will increase cell vascular permeability, vascular permeability, and causes angioedema, angioedema. Okay, what happens in this angioedema? There will be a tissue swelling, and extracellular fluid accumulation will be there. Accumulation, tissue swelling and extracellular fluid accumulation will be there. So there will be edema in subcutaneous tissue, and there will be edema in abdomen. They will cause abdominal pain, and edema in respiratory tract causes obstruction, which will be fatal. Respiratory tract obstruction can occur with the severe edema, and it is fatal. Okay, this is called as angioneurotic edema, and this is an autosomal dominant disease, and this can be triggered by emotional way and trauma. Emotional stress, if you take it as an emotional stress, and if there is a trauma, then this angioneurotic edema is aggravated. Okay, okay. If decay accelerating factor is deficient, then what will happen? They will cause a disease called as paroxysmal nocturnal hemoglobinuria. What happens here? Paroxysmal means sudden, nocturnal means night, hemoglobinuria means hemoglobin will be excreted in urine. Hemoglobin in urine. Okay, why hemoglobin in urine is seen? Because if DAF is deficient, what will happen? If this DAF is deficient, there is increased complement activity. If this complement activity is increased, then there is lysis of RBC and release of hemoglobin, and it is excreted in urine. Okay, this happens with decay accelerating factor deficiency. Okay, this ends the complement system, and thank you.